Hi students, welcome home to Mars. Today we shall discuss about a small nerve loop in the neck. If this nerve loop is injured, it will cause difficulty in swallowing, difficulty in speech. This small nerve loop in the neck is Ansa Cervicalis. To understand the definition of Ansa Cervicalis, first we'll understand the word meaning. Ansa means a loop, cervicalis means a neck. So, by definition, this nerve loop which is present here in the neck can be defined as it's a nerve loop present in the neck. Now, to complete the definition, where does this nerve loop supply? It supplies our infrahyoid muscles. So, it's a nerve loop present in the neck which supplies infrahyoid muscles. So, this is Ansa Cervicalis. Now, the next question. Where is this Ansa Cervicalis located? As you can see in the neck, we have the great vessels like your internal jugular vein, your carotid system of arteries with the vagus nerve that is covered by a sheath. This sheath is called as carotid sheath. So, we shall label this as carotid sheath. Ansa cervicalis, which is a nerve loop here, is located in front of the carotid sheath. That means it is embedded in the anterior wall of the carotid sheath. So, location of Ansa cervicalis, it is embedded in the anterior wall of carotid sheath. Coming to the formation of Ansa cervicalis, it is formed by two roots. One is superior root, otherwise called as descendens hypoglossal, and another root is inferior root, which is otherwise called as descendens cervicalis. Descendens cervicalis. Now, the formation of Ansa cervicalis, we shall learn with the help of a diagram. So, start. First, we shall draw the tongue, the side view. This is the tongue. Label this as tongue. Tongue is supplied by the motor nerve, that is hypoglossal nerve. This is hypoglossal nerve. Label this as hypoglossal nerve, that is the 12th cranial nerve. Next, draw three ventral rami, that is C1, C2 and C3. So, label this as ventral rami of C1, this is C2 and this is C3. Now, the ventral rami of C1 will go along with the hypoglossal nerve for a short distance, then it will leave the hypoglossal nerve and it will descend downwards. This is called as superior root, or you can also call it as we already mentioned, that is the descendens hypoglossal. The C2 and C3 will join together and form another root here. This is called as inferior root. This is inferior root, which can also be called as descendens cervicalis. Now, both the roots will join and this is called as Ansa cervicalis. Ansa cervicalis. This Ansa cervicalis will supply three muscles. So, the way to remember which muscles, you can see the arrows are directed downwards. So, what are the muscles down over here? They are infrahyoid muscles. So, this Ansa cervicalis will supply sternohyoid. It will also supply sternothyroid and it will supply inferior belly of omohyoid. Inferior belly of omohyoid. Whereas from the superior root, it will also supply superior belly of omohyoid. Apart from this, the C1, which has joined the hypoglossal nerve, will continue forward and it will supply two muscles. One is geniohyoid and another is thyrohyoid. That's why in the previous section we had discussed all the infrahyoid muscles are supplied by Ansa cervicalis except thyrohyoid, which breaks all the rule. It does not pull the larynx and hyoid bone downwards. It actually pulls the larynx upwards and it is supplied by C1 through hypoglossal nerve. So done with the formation and branches of Ansa cervicalis. So it's very clear now, Ansa cervicalis supplies the infrahyoid muscles. What does the infrahyoid muscles do? It helps to pull the larynx and hyoid bone downwards after it has been elevated during swallowing. So, if Ansa cervicalis is injured during any block dissection of the neck, patient will have difficulty in swallowing and speech. Thank you for watching. Please share your valuable suggestions. This is Mars, where medicine meets meaning. Thank you.